I want you to imagine something that happens every single day, often without any clear warning. You finish a meal, maybe rice, bread, potatoes, fruit, or something sweet after dinner. You clear the plate, sit back down, and life moves on. Nothing feels dramatic, nothing feels dangerous, but inside your body, something very important has already started. Your blood sugar is rising. Now here is the part many older adults are not told clearly enough. It is not only the big spikes that matter, it is the repeated spikes. The ones that happen after breakfast, after lunch, after dinner, after foods that never tasted especially sweet but still push sugar up fast. Those repeated rises can shape your health over months and years in ways that are easy to miss until the damage is much harder to ignore. And that is exactly why so many people are drawn to one idea that sounds almost too good to pass up, a simple 2-minute trick to lower blood sugar quickly. You may have seen that promise already, maybe in a title, maybe in a short clip, maybe in a message from someone who sounded very certain. And here's the truth. There is a useful idea inside that promise. But there is also a dangerous misunderstanding. Because a quick movement can help your body handle sugar better after a meal. That part is real. But if people hear only that part, they may miss what actually protects them long term. Hello everyone, welcome back to Senior Health with Dr. Sarah Mitchell. Today we are going to slow this down and understand it properly. What happens after you eat? Why sugar spikes matter more after 60? Why muscles can help lower blood sugar? What the so-called 2-minute method is really doing? And why no single trick, no matter how helpful, can replace the bigger daily system your body needs. Because this is where many people get the wrong idea. They think the answer is a shortcut, but the body responds to patterns, not rescue tricks. Let me show you why through a story that will feel familiar to many families. Imagine a man in his early 60s who is told he has type 2 diabetes. He leaves the clinic with medication, a warning about sugar, and a sentence he will hear many times after that. Eat better and exercise more. He wants to do the right thing. He cuts out desserts. He stops sugary drinks. He feels proud of that, and he should. But no one really explains what happens when every meal still contains large portions of bread, rice, pasta, potatoes, crackers, juice, or other foods that can raise blood sugar quickly. So even while he believes he is improving, his blood sugar keeps spending too much time too high, not because he is lazy, not because he does not care, but because he was given general advice instead of a clear system. Months go by, then years. His numbers improve a little, but not enough. He still feels sleepy after meals. He still gets afternoon fatigue. He still wakes at night to urinate more than before. Then smaller warning signs begin, tingling in the feet, blurry vision on some mornings, slower healing after a cut. Nothing dramatic at first, nothing that forces immediate panic, but the process is already moving, and this is the part I want every older viewer to understand. High blood sugar is not just a lab number, it changes the environment inside your body. When sugar stays high too often, it irritates and damages the lining of your blood vessels. It increases oxidative stress, it affects the nerves, it puts strain on the kidneys, it can cloud the lens of the eye, it can make healing slower. And one of the reasons it feels so unfair is that much of this can happen quietly. A person can look mostly fine while the damage is building. That is why relying only on how you feel is not enough. Now let us talk about what happens after a meal in simple terms. You eat. Food is broken down. Glucose enters the bloodstream. The pancreas releases insulin. Insulin acts like a signal that helps move that glucose into cells. But in type 2 diabetes, and often in prediabetes too, the cells do not respond properly. The signal is weaker, the response is slower, sugar stays in the blood longer than it should. That is where trouble begins, because the longer sugar stays high, the longer the tissues are exposed to it. This is why post-meal spikes matter so much, not just fasting sugar, not just your A1C. What happens after meals matters too. Now here is where the useful part of the so-called 2-minute trick comes in. Your muscles have another way to use glucose. When muscles contract, they can pull glucose out of the bloodstream and use it for energy. That process does not depend only on insulin. In other words, muscle activity gives the body another doorway for glucose to leave the blood. That is why movement helps. That is why sitting completely still after a heavy meal often works against you. And that is why even short movement can make a real difference. This is not fantasy, this is physiology. But we still need to be careful here, because short movement helping is not the same as short movement fixing everything, and many videos blur that line because the bigger claim gets more clicks. So let us separate the helpful truth from the exaggerated promise. The helpful truth is this: if you activate your muscles after a meal, your body often handles blood sugar better. The exaggerated promise is this: that a 2-minute movement solves diabetes, replaces medication, or erases years of metabolic strain. That part is false. And older adults deserve the truth, not a slogan. Now let us talk about the movement itself. You do not need a gym for this idea to work. You do not need to run. You do not need to sweat heavily. You do not need to punish your body. In fact, many older adults cannot do that comfortably, and that is exactly why this topic matters. Simple repeated leg movement can help. For example, standing up and sitting down repeatedly from a chair. Heel raises while seated. Marching lightly in place while holding a steady surface. A short indoor walk down the hallway. A few minutes of repeated movement that activates large muscles in the legs. Why the legs? Because they contain a lot of muscle mass, and large muscle groups can use a meaningful amount of glucose when they are working. Now this is where many viewers say, does that mean I only need to do 2 minutes after I eat? No. It means 2 minutes can be a helpful start. That is a very different message. A helpful start is not a complete plan, and if you treat it like a complete plan, you may feel falsely protected. Let me show you the difference. Imagine 2 people both eat the same lunch. One of them eats, then sits for 2 hours. The other eats, then stands up and moves gently for even 10 to 15 minutes, or does short repeated movement right away and then avoids staying fully still. Will the result be identical? Usually not. The second person often gives the body a better chance to lower the spike sooner, and that difference may not look dramatic in one day, but over weeks and months, repeated smaller spikes can matter a great deal. This is one of the biggest lessons in health after 60. Tiny habits, repeated faithfully, often beat grand promises. Now let us bring age into the story, because older adults are not just younger adults with more birthdays. After 60, many things change. Muscle mass tends to decline unless you work to preserve it. Insulin sensitivity often gets worse. Many people move less. Sleep may become lighter or more broken. Stress may become more chronic. Medication lists get longer. Meal habits become more fixed. All of that means the body often needs more support to handle sugar well. So when someone says, just do this one thing, the message feels attractive because it sounds easy. But the body usually needs several supports working together. Let me show you the difference. Imagine 2 people both eat the same lunch. One of them eats, then sits for 2 hours. The other eats, then stands up and moves gently for even 10 to 15 minutes, or does short repeated movement right away and then avoids staying fully still. Will the result be identical? Usually not. The second person often gives the body a better chance to lower the spike sooner, and that difference may not look dramatic in one day. But over weeks and months, repeated smaller spikes can matter a great deal. This is one of the biggest lessons in health after 60. Tiny habits, repeated faithfully, often beat grand promises. Now let us bring age into the story, because older adults are not just younger adults with more birthdays. After 60, many things change. Muscle mass tends to decline unless you work to preserve it. Insulin sensitivity often gets worse. Many people move less. Sleep may become lighter or more broken. Stress may become more chronic. Medication lists get longer. Meal habits become more fixed. All of that means the body often needs more support to handle sugar well. So when someone says, just do this one thing, the message feels attractive because it sounds easy. But the body usually needs several supports working together. Now let us talk about the emotional side, because blood sugar is not only a medical issue. It affects confidence, freedom, and fear. Many older adults feel ashamed when their sugar stays high. They think it means they failed. They think they lacked discipline. They think everyone else must know something they do not. But here's the truth. Most people were never taught clearly. They were told to cut sugar, to walk more, to watch carbs. But they were not shown how repeated meal spikes work, how muscle activity changes sugar handling, or how a useful method fits inside a full daily plan. That is not a character failure, that is an education failure. And once you see that, you can stop blaming yourself and start building a smarter routine. Now let us return to the 2-minute idea one more time and make it practical. If you want to use short movement after a meal, do it in a way that is realistic for your body. If your knees are sensitive, use seated heel raises or gentle seated marching. If standing is comfortable, try repeated sit to stand from a chair. If walking is safe, a short walk after meals is excellent. If balance is a concern, hold a counter or sturdy chair. The goal is not perfection. The goal is activation. You are telling your muscles, use this sugar now. That is the message. And that message can help. But now I need to tell you the part that matters just as much. What you do during the other 23 hours and 58 minutes still matters. This is where many people lose the main point. They do a short movement after one meal and assume the bigger problem is handled. But if the rest of the day includes long sitting, poor sleep, large refined meals, high stress, and very little muscle use, then the body is still being pushed in the wrong direction most of the time. That is why this conversation is not really about 2 minutes. It is about what those 2 minutes represent. They represent using the body on purpose. They represent not staying passive after eating. They represent understanding that muscle is part of your support system. They represent shifting from random effort to a repeatable pattern, and that is powerful. Now let us imagine 2 possible futures for the same person. In the first future, they hear about a 2-minute trick, try it once, feel hopeful, then slowly go back to the same routine. They still eat in the same way, still sit most of the day, still sleep poorly, still think in terms of rescue tricks instead of daily systems. Their sugar may dip a little after one meal, but the wider pattern stays the same. In the second future, they learn the same movement but use it as a doorway into a bigger change. They move after meals more often, they reduce the biggest spikes, they eat in a more balanced way, they preserve muscle, they ask better questions at appointments, they stop expecting one trick to save them and start building a routine that supports them. Which future is more likely to protect nerves, eyes, kidneys, and blood vessels? The second one. Not because it is dramatic, because it is realistic and repeatable. Now I also want to say something for the family member watching. If you are helping a parent, spouse, or older relative manage diabetes, do not dismiss small movement as meaningless. Sometimes what looks small is exactly what people can actually stick with. A short walk after dinner, heel raises while watching television, standing up every 20 or 30 minutes after meals. These are not flashy, but they are practical, and practical often wins. At the same time, do not let your loved one believe that this replaces the full plan. It should support the plan, not replace it. This means helping with better questions too. Questions like, what does my sugar usually do after meals? Which meal spikes me the most? Is my plate balanced enough? Am I moving enough to help my muscles use glucose? Do I need my medicines reviewed? Am I preserving enough muscle at my age? These are good questions, and good questions often create better care. Now let us talk about fear for a moment. A lot of videos try to scare people into action by describing the worst complications. And yes, those complications are real. Nerve damage is real. Vision damage is real. Kidney damage is real. But fear alone does not teach people what to do next. It may create urgency, but it does not always create a workable routine. That is why I want to leave you with something more useful than panic. Clarity. Here's the clear version. High blood sugar after meals matters. Muscle activity helps lower it. Short movement can be useful. Consistency matters more than heroics. And no single trick is enough without the bigger routine around it. That is the real message. Now I want to go one step deeper into why muscle matters so much after 60. Muscle is not only for strength and mobility. Muscle is a major place where glucose can be stored and used. When muscle mass declines with age, the body loses some of its ability to handle glucose efficiently. That is one reason resistance work, walking, chair rises, step practice, and other forms of regular muscle use become so important in later life. So when we talk about a short after-meal movement, we are not talking about a gimmick. We are talking about reconnecting with one of the body's natural tools. Use the muscles, use the sugar, lower the spike, reduce the time your tissues spend under pressure. That is a smart goal. But it works best when it becomes part of a life that respects how the body changes with age. This is also why sleep and stress deserve a quick mention. Poor sleep often makes the body more insulin resistant the next day. High stress can raise blood sugar even before you eat. So if someone is trying a 2-minute method but sleeping badly, worrying constantly, and eating under pressure, the body is still facing strong signals in the wrong direction. Again, this does not make the movement useless. It simply puts it in context, and context protects people from false hope. Now let me speak directly to the older viewer who feels overwhelmed. You do not have to fix everything this week. You do not need a perfect system by tomorrow. You do not need to become someone else. What you need is a good first step that fits your real life. Maybe that first step is standing up after meals instead of staying in the chair. Maybe it is 2 minutes of repeated movement after lunch and dinner. Maybe it is a 10-minute walk after supper. Maybe it is reducing the biggest carbohydrate portion of the day. Maybe it is checking your sugar before and after meals for a few days so you can actually see what your body is doing. Those are useful steps, and useful steps build momentum. That is how long-term change usually begins, not with a dramatic promise, with a repeatable action. So let us come to the real bottom line. The 2-minute blood sugar trick is not fake, but it is incomplete when presented as the whole answer. Its real value is that it reminds you of something powerful. Your muscles can help your blood sugar. Your body is not passive. What you do right after a meal matters. Small movement is worth more than many people realize, and a daily pattern can protect you far better than a rescue trick. That is the message I want you to remember. Not hype, not panic, not miracles. A better framework. And that framework is this. After 60, blood sugar control is built through repeated support. Better meals, better timing, more muscle activity, less sitting after meals, better sleep, better stress handling, better questions, better follow-up. A short movement method can be part of that system, and for many people it is a very useful part, but it becomes truly powerful only when it lives inside the bigger routine. That is how you protect your nerves. That is how you protect your eyes. That is how you protect your kidneys. That is how you protect your future. Now let me give you a more emotional picture of what repeated sugar spikes can mean in real life, because medical language alone does not always land in the heart the way a real story does. Imagine a woman in her late 60s who says, "My sugar is not that bad. It only goes high sometimes. She looks fine. She cooks for her family. She remembers birthdays. She still drives to the store. But every afternoon after lunch, she gets tired enough to sit down just for a minute. Every evening after dinner, she feels heavy and sleepy. Over time, she notices that small cuts take longer to heal. Her feet feel strange in bed at night. Sometimes she blames the mattress. Sometimes she blames age. What she does not realize is that her body has been dealing with the same after-meal pattern again and again, and the body always keeps score. This is why I want older adults to stop thinking only in terms of emergency numbers and begin thinking in terms of daily exposure. A body that spends too much time in a high-sugar state after meals is being asked to absorb that burden again and again. A single high reading is not usually the whole story. The pattern is the story. And this is also why meals should never be judged only by whether they contain obvious sugar. A breakfast of sweet tea and toast may feel light, but it can still hit the blood fast. A lunch built around white rice can look perfectly normal and still push glucose up sharply. A plate of pasta can feel like a family meal, not a health event, but the body still has to deal with what comes next. Now let us talk about why movement right after meals works better than many people expect. When you wait too long after eating and stay seated the whole time, the body has fewer places to send that glucose quickly. But the moment you activate those muscles, especially the larger muscles in the legs, you are creating demand. You are giving glucose a job to do. That is why even very ordinary movement can help. It is not fancy, it is not glamorous, but it is useful. This is where many older viewers actually gain confidence, because the body is not asking you to become an athlete. It is asking you to avoid staying completely passive after a meal. Let us make that even more practical. If breakfast is your biggest spike, that is your first target. If dinner leaves you feeling heavy, sleepy, or slow, that becomes your second focus. And if one meal consistently pushes your readings higher than the others, that meal deserves attention before anything else. This is where checking your response can actually help. Not forever, not in an obsessive way, but enough to learn something real about your own body, enough to notice patterns instead of guessing, enough to stop relying on assumptions. Many older adults are surprised when they finally compare meals. They discover that the food they believed was safe is the one pushing their sugar the highest. They notice that starting a meal with protein and vegetables changes how their body responds. They see that even a short walk after dinner can lower their reading more than expected. That is not failure. That is information. And when you use that information well, it becomes control. Now let me speak to the viewer who says, I cannot walk after meals. My knees hurt too much. That matters. Pain changes what is realistic, so we adjust. We do not give up. If walking is difficult, use seated movement. If balance feels unsafe, use a chair or a counter for support. If fatigue is the issue, start smaller and repeat more often. Even 1 minute after a meal is a beginning. 1 minute done daily is far more useful than a perfect plan that never happens. That is the kind of honesty older adults actually need. Not pressure, not guilt, not impossible routines, real life adjustment. And there is something else that often gets ignored. Muscle. Many people think blood sugar control is only about food and medication, but after 60, muscle becomes one of the most important parts of the picture. The less muscle you have, the harder it becomes for your body to handle glucose properly. So preserving muscle is not just about strength or movement. It is about metabolism. It is about giving your body a place to safely use sugar. Simple things matter here. Chair rises, light resistance bands, step practice, supported squats. You do not need intensity, you need consistency. These are not extra tasks. They are part of the same blood sugar system. Now let me share something more emotional, because this is where many people feel stuck. A lot of older adults feel pulled in two directions. On one side, they see bold claims and quick fixes that promise fast results. On the other side, they hear general advice that feels too vague to follow, so they end up in the middle, trying things, stopping, starting again, feeling unsure. That frustration is real, and it is not your fault, because what was missing is not effort. What was missing is clarity. So let us make it clear, a useful blood sugar routine after 60 does not need to be complicated, but it does need to be complete. A more balanced plate. Smaller portions of fast-rising carbohydrates, some movement after meals, less long sitting, better sleep where possible, more muscle use during the week. Awareness of which meals affect you most. That is the system. It is not dramatic, but it works with your body instead of against it. Now I want to speak to the family member watching. The spouse, the son, the daughter. If you are supporting someone with type 2 diabetes, do not underestimate small changes. Sometimes the simplest habits are the ones people can actually keep. A short walk after dinner, a reminder to move after meals, helping adjust meal portions, noticing patterns. You are not responsible for someone else's health, but your support can make good habits easier to follow. And there is something hopeful here. The body responds to small help. You do not need one big breakthrough. You need less daily strain. Smaller spikes, more movement, more muscle use, better patterns. Over time, these changes build real results. And this is why I do not want you to walk away thinking that if a quick trick is not magic, then nothing works. That is not true. Many things work. The key is putting them in the right place. Understand the small tool. Do not depend on it alone. Use it as part of a full routine. That is how real protection happens. And one more thing before we close this part. If you are already taking medication, these habits still matter. They do not replace your treatment, but they can support it. They can help create a more stable environment in your body. The same is true if you are trying to prevent things from getting worse. This is not only for severe cases, it is for anyone whose body is already showing signs of struggling with sugar. So if you remember a few simple ideas, remember these. Do not fear movement after meals. Use it. Do not rely on one quick fix. Do not wait for symptoms before you act. Do not assume only sweets are the problem. Do not underestimate small habits. These are the actions that protect you. And if you feel tired of trying, hear this. You are not behind. You are not too late. You do not need to be perfect. You only need to start with what is realistic for you. Pick one habit, keep it, then build from there. Because the body always responds to what you repeat. Thank you so much for watching Senior Health with Dr. Sarah Mitchell. If this video helped you understand your body in a clearer and more useful way, please like, subscribe, and turn on the bell so you do not miss our next videos. This video is for educational purposes only and does not replace medical advice, diagnosis, or treatment. Please speak with your doctor or qualified healthcare professional before making changes to your medication, exercise, eating routine, or treatment plan. Please take care, stay safe, and may you have better health, more peace, more comfort, and more strength in the days ahead.